COVID-19 has laid bare an undeniable fact. The people hardest hit are those who already lack resources, have limited access to quality social and clinical care, and in some cases are one paycheck away, or even worse, from putting food on the table or paying the rent. Study after study shows that people who are suffering the most, both medically and economically, during the pandemic, are the ones who were underserved before the global crisis became reality. Tune into our next episode to learn from Dan Brillman, CEO of Unite Us, and how he and his team are using their proven infrastructure to align all stakeholders from healthcare, government, and the community around a shared goal to improve health, especially during the coronavirus outbreak.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us. Dan, thank you so much for joining us on our podcast today.
Thanks for having me.
Well, Dan, I'm eager to dive into our very important discussion today, as I know our community will benefit greatly from your inspiring work and to also understand some of the pivot you and the team put in place due to the pandemic. But before we dive into all of that, a bit of housekeeping. While listening to any of our episodes, please take a moment and visit passionatepioneers.com in order to share your feedback and ideas. Simply scroll to the comment section at the bottom of each posted episode. And lastly, please take a moment to subscribe to the podcast. You will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli in Apple Podcasts, Spotify, or wherever you listen to your podcasts. Well, Dan, I first got to start by saying thank you. Thank you for your service. I know you've been serving our country for a number of years now by way of being a fighter pilot. So we're going to start right from there. I'm fascinated by flying pilots and jets. What's that like? What's it got to be like being in that cockpit?
Yeah, I would say, 13 years ago when I started doing it, it was definitely, the most exciting thing you can think about, and especially all the training that you go through. And, as you do any job over the years, there are amazing parts about each flight. And at the same time, it's a job and it's a mission. So, a lot of things become very standard. So sometimes I explained to folks that, when you're doing mid-air refueling as an example and going up there, sometimes it feels like a video game that you're just doing over and over again. But if someone else saw it, they would be, pretty scared for the first time seeing, a plane within 10 feet of another plane. But it's definitely, there are exhilarating parts of every flight and fun parts that you always learn from, which is the most exciting part about being a pilot.
So I'm fascinated by this. We can make a whole podcast just out of this topic because I have so many questions that I want to ask, but I'm going to ask two and then we're going to get after it. So one, is it as tight as it looks inside that cockpit? I mean, it looks like you guys are slammed in there.
Yeah, in small planes, it's very tight. There's not much wiggle room. You bring some food and things like that, but you get used to it. I went through a year and a half of just training in those planes when you've never been in one before. So you get pretty used to it.
And last question, I promise. Have you gone straight up in the air with your jet?
Yeah, of course. Especially in training days, you practice all of those things, including scary things like spins, where you learn how to get out of a spin. So you have to go straight up before you go down and practice those, obviously loops and everything like that. It's all part of the training.
I mean, of course, gradually climbing and ascending in the plane, that's kind of boring. But if you can go straight up immediately, man, that sounds so cool. So that's awesome. Well, again, Dan, like I said, we could turn this into an entire podcast. I'm so fascinated by it. But in all seriousness, thank you for your service and everything you've done for our country. And speaking of service, we're also going to talk about your incredible company, Unite Us. And we're going to discuss some of the things we're going to focus in on today are around what you've done as an organization to pivot towards COVID-19, pivot towards, answering the call for this crisis, this generational crisis, this once in a lifetime event that hopefully will be once in a lifetime event that we've seen. But let me set the stage for just a moment and we'll let you dive in. So for over 7 years, you and the team have been strategically building the technological infrastructure to allow for secure information sharing between community network providers, enabling them to send and receive electronic referrals and to track outcomes together to ensure people are getting the care they need. Can you give us first that high level of Unite Us, how it came together? And then from there, I really want to dive into where you pivoted, how you did it in order to help address this issue that is COVID-19.
Sure. So, 7 years ago, we actually started focusing on veterans because it's close to our heart. We knew the market really well. And really with the foundational belief and validation, of course, too, that healthcare, government, and social services were all serving the same veterans and their family members, but no one knew about it. And so it wasn't just about, how do I connect someone to a service? How do I address a social need? It was around how do I get these organizations communicating together in a secure ecosystem that allows everyone to stay on the same page, with the most important part about focusing on an outcome. And, the reason we started is Taylor, my co-founder, and I were trying to help veterans that we served with. And it was so fragmented trying to help them. And, at the end of the day, what we wanted to know is, did they ever get the help they needed? And it was always a multitude of services. It was never just one thing. And so, for the last 5 years and 7 years since we started, the industry talks about connecting people with resources and social determinants of health. And that's always been, foundational to our work. And those words are important, but the means in which we do that is key. The focus on outcomes is paramount. And then doing that across 40 states where we operate now, I think is showing where the industry is going. So where the industry has moved very quickly and why COVID, and we'll get to that, is really important, is because people talk about, lists of services or a supply and demand issue, which of course it is about that at a macro level, but it's more than, how many people search for what. We're talking about at the granular local level where you and I live, where we need services, what's actually happening, and the quality and accountability of the delivery of services. So that requires a few very foundational things. One is that is very secure data exchange between these entities that don't talk to each other electronically. And then the second part is, how do you programmatically get these organizations standardized? What does an outcome even mean? And when people talk about that infrastructure, those are the things that are required. And then you build upon those, which we'll talk about as we get into COVID-19, which has been an exciting moment for us to help people in need.
Well, thank you for that overview, Dan. I really appreciate it. And we'll be sharing some contact points with the community towards the back end of where they can find more and to get involved in this incredible work that you and the team have been up to for quite some time now. But so let's pivot towards COVID. You had a beautifully written blog post over at the health website, the HLTH, and really discussed this pivot back in May of 2020. Can you first describe how did that happen? Where were the aha moments? What was it like in the boardroom to say, okay, team, here we are, crisis is in front of us, let's pivot. Let's start focusing some of our energy and opportunity to help solve for this. Take us into that war room, if you will, making those decisions, what that was like, and then we'll dive into what those decisions actually were. How's that been in practice out in the marketplace? But take us to that moment of making those decisions.
Sure. So first and foremost, the decisions are not just me. We have an amazing team of 270 people that have really good ideas on how to address that. And it came back to, what can I lead from our end? And our vision is to ensure that, our platform and this infrastructure is across the country into every health and human services hands. So how can we do that in a world that was unsure of where the future was going at the beginning of a pandemic? And so that really took our team to say, where can we invest heavily? Where there's two places, obviously, that come to mind immediately where we did that. But of course, we've added 9 or 10 states since the pandemic started. So that hasn't stopped. But, one is New York City, where that came close to our heart. So our point to that was, what can we do to accelerate the work that we're already doing? That was one part. The second part is, what can we capture and how can we help the stakeholders who are having issues tracking data or providing services? Because, everyone only provides 1 or 2 services max, like a hospital provides medical service. How can we help them address the pandemic in a way that's effective for them, but also not making them go out of their scope? How can we collect more data and I'll talk about that. And third is, how can we use that data to get ahead of that? And I'll bring up an example around eviction, where it's, getting ahead of that and seeing what's happening from utility assistance data to an actionable result, where a community in Louisville, Kentucky, we helped set up what we call a coordination center to address specific needs around eviction, immediately, to get ahead of the evictions that were coming, because that would have been exacerbated if we didn't do that. So we can talk about those in 3 phases. And what came from our team were solutions. And I'll name a few of them. One is, we wanted to capture data at community-based organizations around COVID-related needs. So, people had needs before COVID, but which ones were exacerbated or because of the pandemic? So it's one thing for the industry or someone to say, oh, food needs, they went up. So we all know that. Which ones were related to COVID? Because that's a very specific point, because we look the demographics and things, because we can tie unemployment and things like that to different populations based on the needs that they have related to COVID or not. The second one is exposure to COVID-19. And we think of that in a medical lens, when we watch TV and testing. But really what we empower when this infrastructure is in place is for all the social service agencies in the network, including hospitals as well, everyone in the network to be able to capture this type of information. And what we set up for success was the ability for social services to capture this exposure before a hospital ever knew about it. And because the system that we built is built around a shared client and a secure patient record with a lot of nodes and a lot of information around the client that's securely protected, we capture a lot of information at the food pantry, which the hospital wants to know. Insurance companies want to know that. Public health and governments want to know that. So these are the types of things that we got implemented very, very quickly because we had the infrastructure in place, which was the baseline things we were talking about earlier, which is electronic referrals, outcome tracking between all these partners.
And thank you for that, Dan. And so how was that rolling out? So you made that, like you said, it was a team decision, and I appreciate that, being a team guy myself and rallying the company around some of these pivot points to really focus in on, answering the call for our country. So you make these decisions, you outline some of what those decisions were. How was the rollout? As you know as well as I do, there's never a straight line in building a startup. Were there some roller coaster moments? Were there some things that did work, didn't work? How was the rollout for Unite Us to answer this call and helping our country battle this pandemic?
Yeah, I think what's interesting is all of our partners were really receptive to the rollouts. And I think because the simple answer is we're all humans and they all didn't know what was going on and they wanted answers, right? They wanted any solution in their hands because no one knew what the answer was and what to do with the pandemic in full. And we had answers for them. And so they were all very receptive to that, to the point where when we rolled it out, I would say the asks kept coming, right? What more can we do? What more can we do? What reporting can we do on this? The asks, I think, was after the rollout was the hard part because we had to go so fast and then we had to catch up after. And the good news is this is all coming from our community partners, which is great. That means that they were getting value out of it. It was helping them. And at the end of the day, we had to continue to respond, which I think is we continue to do even to this day as the pandemic continues.
Wow. Were there any hiccups? Were there any false starts? What was some of the, in the trenches, like I said, there's never a straight line in building a startup. Were there some parts where you thought, yeah, that would work, but it didn't? Give us some of those gory details along the way as well that were difficult, and then you overcame them as well to help, again, those stakeholders.
Yeah. We had a very bold goal in the state of North Carolina. We work with DHHS and United Way and most of the hospitals and the payers and thousands of social service agencies, but across 100 counties. And our goal was by the end of this year, and now we're back to March, by the end of 2020, we wanted to roll out in all 100 counties. And the biggest challenge for us was we wanted to accelerate that. And the question was, can we go do it? And so that means we have people on the ground that are talking to these social services, getting them on the network so that they can start working together around shared clients. And so accelerating that was a very difficult proposition for the company. It wasn't that it was asked for we want to get people help, right? And this is the time to be able to do it. And so accelerating that was a challenge and we overcame it. We did it 6 months in advance. We got thousands of organizations on, we hit all 100 counties. And, that was important for all the stakeholders, including FHLI, which is the foundation, the state of North Carolina, up to the governor promoting this. And so that was a big challenge we took on. But accelerating and this infrastructure build across the entire state much faster during a pandemic was very challenging. But also we overcame it, which is great. The second one is in New York City. So New York City is a very fragmented landscape. And I think it's a huge city and it's just a big one to tackle. And so in this response, we wanted to do what we call a rapid response network, where we had core partners in public health solutions and Air NYC, these community partners who are already working with some of these hospitals. We wanted to accelerate that. We didn't want to monetize it. It was about, this is our home. This is where our headquarters is. We want to help people and doing that and getting that off the ground very quickly within weeks and getting 100 plus partners on the network. And after doing that, making sure that it's performing really well and has a 93% acceptance rate of electronic referrals, meaning 93% of people are getting enrolled in services and within a few days. That's amazing stuff during a pandemic. And that was happening in March and April. So these are challenges we took on and, they definitely had ebbs and flows because of our platform and our approach is multi-stakeholder, there's always going to be, tough calls and tough conversations, but people, I think during the pandemic wanted answers, and I think they got them from us.
All right, I'm fired up, man. I'm ready to come over there and run through some walls for you. It's just, this is why I love, and I'm so fortunate and humbled to be able to work alongside leaders like you across this country and startup founders and executives and just digging in, figuring out a way to make it happen. It is just so inspiring. So thank you for taking myself and our community through that journey. Dan, let me ask you, with this pandemic, do you see either part or all of your business being forever changed? I mean, have you seen things that you're not going to go back to how it used to be? And I'll keep that high level broad for you, but are you seeing some changes within the organization that will be moving forward even after this pandemic?
Yeah, I think when we moved to all remote, it was definitely a change for us because we have 100 plus people that are MPHs, MSWs that are local across these 40 states. And so, relationships are very key and important to how you do this work. And the important part is it still worked, and we still did it via Zooms and all of that stuff with community partners. And the future, of that is it's going to stay the same. Now we'll get back to community meetings in person, and we'll do those things as we come. So that's not a foundational, change for us. It's something we've had to deal with over the last 6 months, and it's been very efficient and very successful. The future, though, I think how the business change is it's going to accelerate this industry. And it's going to accelerate it at different levels. It's accelerating it at the federal level, at the state level, and at the community level. And so I think that's going to be the biggest difference between what happened before the pandemic and what happened after. And it's not that social determinants is, now the coolest term. It was always a priority, but now it is really here to stay. And I think it manifests itself in a different way in the sense that we're seeing states, we have 8 or 9 states that have come to the table in the last 6 months where we're building now, which is, unbelievable in a time of a pandemic, because what they've exposed and what they've seen is that the government can't take this on, but yet they need a solution for public health. They need a solution. What I asked about before is the connection between all of these entities electronically, the tracking of what's happening, to be able to move upstream and not just connect people with food, because if it's from a hospital and an emergency room visit, it's already too late, right? So we need to really moving upstream. And that means you're getting pressure in a good way, meaning federal, state governments are saying, these are the solutions that we need. It is not about, how do we just connect people